Now to the State House, where Democrats are discussing a bill calling for the state to help fill the gap left by the end of Affordable Care Act tax credits. 55,000 people in Maine have seen their health insurance costs go up.
And as Maine Democratic lawmakers present their plan to address the problem, Republicans already saying it is too expensive. Christian Harsa joining us live from the State House with more. Christian.
Hi, Brian and Amanda. Democratic House Speaker Ryan Fecteau, with dozens of his Democratic colleagues behind him, championed his proposal for the state to spend $250 million to help Mainers cover their health insurance costs. But Republicans here at the State House that I've spoken with don't know where the state would get that money.
This one big, beautiful healthcare bill will take critical steps.
Critical steps laid out in LD 2208, sponsored by Democratic House Speaker Ryan Fecteau. He proposes creating 3 separate funds to help fund rural hospitals, to safeguard against future federal funding cuts, and to help pay for health care in Maine after the Trump administration and Congress passed H.R. 1, ending Advance Affordable Care Act credits.
What they did is take a bat to the shattered glass on the ground and made this broken healthcare system even worse.
Fecteau says the state can't cover the full cost.
But we're going to do our best here in Maine to make sure we can pick up some of these pieces.
To do that, Fecteau is proposing pulling from the general fund, totaling more than $250 million. Republican Representative Amy Arata sits on the Appropriations Committee, the group responsible for drafting the legislature's budget proposal.
Based on the budget that the governor had submitted, this is how much money we're going to have left for bills. $0.
Well, we're going to make sure that we find a way to address these challenges. We have a rainy day fund that's over $1 billion.
Governor Janet Mills wants to spend a third of that $1 billion fund. Republican lawmakers don't want to spend any of it.
The Budget Stabilization Fund is to make us whole when we have an economic downturn.
Fecteau argues without assistance, Mainers will go without health insurance, and Maine hospitals will continue to struggle.
We have an obligation. We cannot let our hospitals close. So who picks up the tab? We do.
Arata says if Democrats could find the money, she would support the bill.
I just don't think it's realistic in light of the financial reality that we have in the state right now.
These are the kind of choices we're going to have to debate. That's what this session's going to be all about. I asked Fecteau specifically about the $300 checks that Governor Janet Mills is proposing, which would pull nearly $220 million from the Budget Stabilization Fund. Fecteau says that those checks are just a one-time thing, and he questions whether or not Mainers would prefer that one-time check or a program like the one that he proposed today. Now, Brian and Amanda, we're going to see more and more of these conversations and debates as we move further into the budget season here at the State House.
Christian Harsa at the State House. Thank you.